about the pneumothorax. So in these photos we will speak about the pneumothorax. We have on CT and we have on X-ray. So on CT there is air in the pleura, air in the pleural cavity, and partially collapsed lung. But on chest X-ray we have compression by pneumothorax. This is collapsed lung, and this is tracheal deviation due to tension pneumothorax. So pneumothorax means what? Means accumulation of air in the pleural space. So this is the pleural space, accumulation of air in the pleural space, leading to what? Leading to collapsed lung, leading to what? Leading to dyspnea, uneven chest expansion. What's meant by uneven? Unequal. There is difference between chest expansion on the right side and on the left side, so it's unequal chest expansion. Then there is chest pain. There is decrease in tactile vocal pherometers. Why? Because there is air in the pleura, and the pleura between what? Between the lung and outside the lung, So if there is air pneumothorax in the pleura, air in the pleura, leading to what? Decrease transmission of the sound, decrease tactile vocal parameters, then hyperresonance. Why? There is air in the pleura, leading to hyperresonance, then diminished breath sound. Why? Because there is collapsed lung. So the lung is responsible for this breath sound. So if there is air in the pleura, in between the lung inside and outside, leading to what? Leading to diminished breath sound because of collapsed lung. Then all on the affected side. So here on the right side, then here on the left side. Then what are the causes? We have primary spontaneous pneumothorax, we have secondary spontaneous pneumothorax, we have traumatic pneumothorax, and all of these causes can lead to what? Can lead to the tension pneumothorax. So we have the primary type. What is primary? You must memorize these keywords. It's what? Tall, thin, young male, plus rupture of apical subpleural polyps. So we have rupture apical subpleural polyps or cyst in a patient who is tall, thin, young male associated with what? With tobacco smoking. So in primary spontaneous pneumothorax there is what? Rupture of apical subpleural polyps in tall, thin, young males associated with tobacco smoking. Then secondary to a disease in the lung, like bully in emphysema or Marfan syndrome or infections, or this is so important, barotrauma, mechanical ventilation with high pressure, leading to rupture, leading to secondary spontaneous pneumothorax, rupture, which is called what? Barotrauma. Then this is the secondary due to disease in the lung, bully in emphysema or Marfan syndrome or infections. Mechanical ventilation with use of high pressure, it's called the barotrauma. Then the next one, traumatic, from its name, caused by what? By blunt trauma like rib fracture, and rib fracture will cause what? Will cause pneumothorax. Then penetrating gunshot, iatrogenic like what? Central line placement, or lung biopsy, you are taking biopsy from the lung, or barotrauma like the previous one, usage of mechanical ventilation with high pressure, which is considered as secondary cause, secondary spontaneous pneumothorax, plus it's traumatic due to mechanical ventilation trauma. So traumatic due to what? Blunt trauma like what? Like rib fracture, penetrating gunshot, iatrogenic like central line placement, or you're taking biopsy from the lung, or barotrauma like the previous one, the secondary usage of mechanical ventilation with high pressure. Then the next one, all these causes, the primary primary one, which is thin, tall, young male with rupture apical subpleural polyps associated with smoking. Secondary to many causes, or traumatic. So all these causes will lead to what can lead to tension pneumothorax. What's meant by tension pneumothorax? It can be from any of the above, primary, secondary, or traumatic. Then the air enters into pleural space but cannot exit, increasing trapped air leading to tension pneumothorax. This tension pneumothorax leading to what? Trachea that will deviate away from the affected lung. So here there is collapsed lung on the left side, there is compression by tension pneumothorax leading to tracheal deviation to the right side, so tracheal deviation away from the affected lung, so may lead to increased intrathoracic pressure, leading to what? Mediastinal displacement. So the trachea and the mediastinum will be displaced into the opposite side, leading to what? Here there is superior vena cava, here there is inferior vena cava. So kinking of the inferior vena cava, bending of the inferior vena cava, which will lead to decrease in the venous return to the heart. So there is a decrease in blood reaching to the left side of the heart, leading to decrease the cardiac output. Plus this tension pneumothorax will cause what? Obstructive shock, which means what? There is decrease in the cardiac output, which means hypotension. Then there is reflex tachycardia to this decrease in hypotension, plus compression on the mediastinum by the tension pneumothorax, leading to jugular venous distension. So it needs what? Needs immediate needle decompression and chest tube placement. So needle decompression in which site? Second, the intercostal space, mid-clavicular line. So second, the intercostal space, mid-clavicular line. Then the chest tube placement in which site? Fourth or fifth intercostal space in mid-axillary line.